Hello, everyone, and welcome to the course on child and adolescent health in humanitarian settings. This is a collaboration between the WHO-EMRO office and the Geneva Foundation for Medical Education and Research. So today we're going to talk about coordination, which is the first module of this course. My name is Beentjes, and I'm a technical officer working on child and adolescent health in humanitarian settings here at WHO-EMRO. This training is mainly based around the operational guide on child and adolescent health in humanitarian settings. I'm going to start with some tips on how to use the guide. One of the things that's very important is to first get familiar with the entire guide before you start using it, and also to identify areas that are most useful for your team. Then you can go ahead and review key actions, which every module has, and then see how they're applicable to your team. Then we advise to repeat the cycle each time, addressing things more fully. So you work through the entire guide in preparation of an emergency, and then you quickly go through the guide in the first month of an emergency and systematically revisit all the chapters. We also have a self-assessment tracker in Annex 1 of the guide to track your improvement on this. It's very important for us to do these kind of trainings because the WHO produces a lot of technical guidance, but for us it's also very important to implement this guide in the countries in our region. I'm going to start with some humanitarian principles that this guide is based on. The humanitarian principles are humanity, impartiality, neutrality, and independence. And these are grounded in the human rights and in international law. These include the right to live with dignity, the right to receive humanitarian assistance, and the right to protection and security. Because this course is on child and adolescent health, we added here that children have additional rights under the Convention of the Rights of the Child. One of the important documents in this area is the Core Humanitarian Standard, which you can see on this slide. This is a consensus document that sets the 9 principles to help humanitarian actors improve the quality and effectiveness of humanitarian action. And these are all around the 4 humanitarian principles, again, as you can see in the middle of the circle. Then the main humanitarian guidance document is the Sphere Handbook. The operational guide is based on this, and all the key actions that come from the operational guide are coming from this book. This is created by a broad group of humanitarian actors and accepted by most humanitarian agencies. And the book also includes the Humanitarian Charter, which outlines the ethical and legal foundations of the humanitarian action and also has the minimum standards in the humanitarian response. Then I will move on to coordination. Humanitarian coordination involves bringing together humanitarian actors to ensure a coherent and principled response to emergencies. And here the aim is to assist people when they need relief and protection. Humanitarian coordination seeks to improve the effectiveness of the humanitarian response by ensuring greater predictability, accountability, and partnership. Effective coordination is essential, but is very challenging. There are variations in approaches and perceived priorities among humanitarian actors. And an example of this is the current conflict in Syria, where before the conflict, there was a big priority on family planning and adolescent health, whereas now that the conflict is there, there's a less priority on these kind of actions. So priority setting is really important, especially in humanitarian settings. There's also an importance of a system-wide coordination for a quick and efficient assistance. The coordination section guides you in setting up, participating effectively in coordination structures during humanitarian emergencies as well. Then this slide shows you the 4 interconnected programmatic action areas of the operational guide. And today we're going to focus on the first one only, which is coordinate. This includes how to take a coordinated approach to child and adolescent health in humanitarian emergencies. This is the index of the guide, and it includes which chapters will be discussed today, and we will focus on coordinate. So this is divided into 5 different chapters, starting with participating in humanitarian structures, then going into identifying the key humanitarian actors, establishing a working group on child and adolescent health, communicating clearly, and advocating strongly. So to start with, this is the first part of the chapter on coordination, which is participating in human structures. To integrate child and adolescent health into humanitarian action effectively, governments and organizations must be able to navigate through humanitarian structures, and this is why I will go into some more actors on a global level and on a national level. On a global level, the most important actor is the Interagency Standing Committee, or the IASC, which coordinates the humanitarian action and is headed by the Emergency Relief Coordinator. This is composed of UN agencies and international NGOs, and it's responsible for coordinating key agencies and assigning responsibilities and sharing resources and information. And it has a designated responsibility using a cluster approach. I will go a bit deeper into what the cluster approach entails. The aim of a cluster approach is to build capacity of national systems to respond to humanitarian situations with a protection and accountability lens, and progressively hand over coordination to local entities. So it's not aiming to take over from national system, but it's supposed to support national systems. And all of these clusters have their lead organizations called cluster lead agencies. The cluster system also aims to spread accountability for delivery of services across the different cluster lead agencies. And then the clusters include group of humanitarian, UN, and non-UN organizations in each of the main sectors of humanitarian actions. This slide shows the cluster approach and the global lead agencies linked to that. So here, for instance, you can see that related to health, you have the WHO, and related to water, sanitation, and hygiene, there's UNICEF, and there you can see how they're all divided between the different UN agencies. Then continuing, I will go on to the national level. Clusters are only activated by the IASC when existing structures are unable or unwilling to meet the needs of particular humanitarian emergencies. And in-country clusters are intended to be temporary coordination solutions with a handover to local authorities as soon as possible. UN OCHA is usually overseeing all these clusters, but it can also be national governments. Humanitarian emergencies attract a wide range of actors, and governance structures may not always be clear. One of the examples of this is the current conflict in Syria, where the coordination is divided into 4 hubs that are spread over different countries, which makes this a very multi-layered approach. But we will talk about this more in the assignment. We have added a reference to the assignment in which you can read more about this, and we will explore this more. Then clusters should go beyond information sharing and making coordinated decisions about resources, activities, and also about strategic direction. And a working group can fulfill the role of a health clusters, but it's preferred that this is led by the Ministry of Health. The key actions that are linked to this are, first of all, identify and communicate. Contact the leading health cluster organization, national or subnational, to coordinate activities, share your work areas, and offer coordination support. Then we have support coordination, assist in establishing a coordination mechanism if existing ones are lacking or weak. Then conducting coordination meetings regularly and sharing information, updates, and bulletins. Linked to this, we have one key indicator with which you can measure if you're doing this. This is your organization is connected with the health sector or cluster in your region and actively communicates with partners and contributes to health and other sectors or cluster updates. I will then move on to the second part, which is identifying key humanitarian actors. The most important actor is always the affected communities and individuals. Then we have the local community, including civil society groups and schools, the government, including ministries of health and other ministries. We have local NGOs and international NGOs, and then we have UN agencies and interagency. I will go in a bit deeper into what their roles are. For the UN agencies, they mostly coordinate and they provide technical expertise. Then there's governments who have the main responsibility for population protection, coordination, implementation, funding, and also, of course, local expertise. And then the local community and NGOs are the main providers of humanitarian action, staff, and also local expertise. And then international NGOs, they're also responsible for implementation, coordination in specific areas, staff, technical expertise, advocacy, and resource mobilization. It's important to take accountability to affected populations. This includes taking account, enabling input from all affected populations. It includes giving account, providing information on actions and regions, and being held to account, which allows community to assess the quality of the response. Then the Interagency Standing Committee commitments on accountability to affected populations. This includes leadership and governance. It includes transparency, feedback and complaints, participation, and also design, monitoring, and evaluation, engaging affected populations in M&E and reporting and learning from the process to improve outcomes. The key actions that are linked to this are, again, from the sphere standards. This includes identifying and engaging partners. This is identifying and reaching out to partners with child and adolescent health and working collaboratively to establish common systems and prevent duplication. And then the second one is integrating the core humanitarian standards into your operations, utilizing these to hold yourself and also everyone around you accountable for humanitarian engagement. The key indicator that is linked to this is that the health sector lead has identified and connected with the health sector lead agency and partners in child and adolescent health and are committed to working together. Then the third part is establishing or strengthening an RMN-CAH or CAH working group. And the importance of an interagency working group is that it's essential for effective and cooperative integration of RMN-CAH activities into humanitarian actions, and this should operate under the health cluster. The WHO and the Ministry of Health are accountable for the activities, and it should nominate a leading agency for the working group. It can be led by government bodies, local or international NGOs, or UN agencies collaborating effectively with the Ministry of Health. It can include members of various sectors because of cross-cutting issues related to child and adolescent health. So it can also include, for instance, nutrition or protection. And it's important to coordinate activities locally and provide feedback linking to both local health authorities and the national R&M-CAHS working group. The key actions linked to this are identifying lead agencies to lead the working group, establishing a working group at your level. This includes determining the composition, including civil society members and also young people, developing TORs, and also developing a plan for meetings and communication. Then the next one is to liaise with stakeholders, clarifying roles and integrating priorities in the humanitarian response plan, and then engaging partners and contributing updates, meeting regularly to contribute to health and other cluster or sector updates. The indicators linked to this are that at the onset of the emergency, a national RMN-CAH or Child and Adolescent Health Working Group has been established under the health cluster with a nominated group lead and clear terms of reference. And there's also a sub-national working group when needed. The working groups meet regularly and communicate their activities with other agencies, clusters, sectors, and the community. Then the last one is that the RM and CAH issues are fully included in humanitarian response plans. Then I will move on to communicating clearly. It's effective communication strategies require an understanding of the situation, also the affected people, current response efforts, and available communication channels. It's important to address the needs and capacities of children in communication strategies, and a useful tool for this is UNICEF's CHAT, which stands for Communication for Humanitarian Action Toolkit. I have put some more information from this toolkit here, and they provide some tips on good communication. So this includes being prepared and communicating now, working with partners, engaging communities, building an evidence base, promoting awareness and action, testing your approach, and assessing your impact. Then the key actions that are linked to this are communicate urgent messages and do not delay with this. Develop a communication strategy and assess the current situation to identify your priorities involving children and young people, and coordinate CAH-related help messages between agencies and sectors. The key indicator linked to this is that the working group and individual organizations have developed a communication strategy and are working together to implement it. Then the last part of this chapter is advocate strongly. It's important to advocate to decision makers about the benefits of effective coordination, and the target audience for this is governments, NGOs, UN agencies, community leaders, donors, and health managers at all levels. So this includes local, national, and global. Be an effective change agent, advocate for the health needs of children and adolescents to decision makers. And it's always important to engage children, adolescents, and parents into these decisions. Then I have a slide on nurturing care for children living in humanitarian settings. Humanitarian standards vary in their intention to children and their caregivers. And it's often that the priority is on child survival and not on the quality of life of the children. This is why in 2021 a thematic brief was launched to shed a light on this, to see the needs to better ensure children in humanitarian settings receiving nurturing care. This brief summarizes what program planners and implementers can do to minimize the impact that emergencies have on the lives of young children and also on their families. In another week, we will go a bit deeper into what nurturing care is and how this can be implemented. The key actions that are linked to this are taking the lead, that the working group must take the lead in advocating for child and adolescent health in humanitarian settings, and health leaders and agencies in child and adolescent health need to work together to advocate for the needs of children and adolescents, including human rights, data, prioritization, funding, community, and participation. The indicator that is linked to this is that the working group and individual organizations work together to advocate for the health needs of children and adolescents. Then here I put some references which you can use. You can also find these in the guide. And then I also put some tools that can help you improve your coordination within your team. That can also be found in the guide again. Thank you very much for your attention. And if you have any questions, you can contact me under beentjesk@who.int, or you can also contact Dr. Khalid.